manager overseeing the development of our next generation of SuperSeal medical devices. So these SuperSeal devices are used to cut and seal tissues during surgery, like a colectomy. That's removing part of the colon. So if a patient has colon cancer, here's a colon here, the surgeon cuts out the tumor, but he also needs to cut through the tissue around the colon and then cut and seal the blood vessels that supply it too. Our SuperSeal device does all of that, and it does it by applying pressure and then energy to the tissue and the blood vessels.
So it smashes and burns the tissue?
Well, basically, although it doesn't sound that great when you say it that way. You're in marketing, remember?
Oh, right.
Our main competitor is SealAssure, and they have 65% market share. We've been struggling with our current products to steal that share. That's where our next generation of products and you come in.
Well, I'm ready for the challenge.
It's good to hear. How about we head over to the lab and meet some of the engineers with whom you'll be working?
Absolutely.
JR, Lydia, I would like you guys to meet Pearl. Pearl's going to be the new product manager who's working on the next generation SuperSeal product. Welcome.
We're excited to have a product manager again, especially after what happened to the last one.
Wait, what?
Why don't you guys show Pearl what you're doing with the latest prototype?
Why, we're bursting blood vessels, of course.
You're doing what?
Bursting blood vessels. This is the main test we do to show how well our SuperSeal product seals blood vessels, especially the big ones. We're testing the newest prototype right now. And not to brag, but we created the burst vessel test ourselves. We take pig blood vessels and we seal them with the SuperSeal. Then we fill the sealed blood vessels with saline until it bursts. And then when it does burst, we measure the pressure.
And we need to get a minimum threshold that is expected by the FDA.
And, more importantly, you need to have a higher burst pressure than SealAssure, right?
Yes, we need a higher burst pressure than SealAssure.
So do all companies use this test?
They do now, it's the industry standard.
We helped pioneer this test when our method was published in the American Society of Mechanical Engineers Journal of Medical Devices. It became the standard that everyone uses.
I haven't heard of the American Society.
Yeah. No one has. No one has.
Oh!
As you all know, we've identified possible claims for our next generation SuperSeal versus SealAssure. The objective of the meeting today is to discuss the progress we've made on the claims testing. I've asked Pretty, our Manager of Regulatory Affairs, to be here today, since she has to approve any claims that we make. First, let's talk about our ergonomics claim. SealAssure has really terrible ergonomics, so we think we can really win here. JR, how's the ergonomics testing going?
The results are fantastic. 100 surgeons used our new SuperSeal and the SealAssure, and 90 of them preferred our ergonomics over the other device. We've got this claim for sure.
Oh, wait a second. Did you pick 100 surgeons who have tiny hands?
Of course not. We used male and female surgeons with all different sized hands.
Okay, that sounds good. What's next?
Our second most important claim is thick tissue. So SuperSeal doesn't really seal thick tissue very well. A lot of times there can be bleeding or oozing, and this isn't dangerous, but it is a nuisance on surgeons. So how's that testing going?
Really good. The SealAssure had noticeable oozing of blood 50% of the time, and our device had it only 4% of the time.
Well, is it statistically significant? We need p-value of 0.05 or less.
Yes, we are easily statistically significant.
Great. Our next big claim is big vessel sealing. We think it's the most important. The problem is that SealAssure is really good at sealing big vessels. So how's that testing going?
Well, as you know, we test our big vessel sealing with the burst pressure test that has been industry standard since we published our method in the Journal of Medical Devices. Our big vessel sealing is really good. We're well above the FDA standard.
And how is it versus SealAssure?
The burst pressures are higher, but our p-value is 0.08.
I will not approve the claim if the test results are not statistically significant.
We've tried device modifications, but we just don't think we're going to get that statistical significance.
Okay. Well, I think we have some really good claims here with ergonomics and thick tissue. Thanks everybody for all your hard work.
Your market research with surgeons to select your lead product claim starts in a month, right?
Yes, that's right.
This market research is very important. It will help us to select which claim will be the main claim that we use versus SealAssure in all of our advertising. I'd like to discuss which claims that you'll be testing in the market research. As you know, our budget was cut this quarter because we have not had a good year. So we only have sufficient budget to test 2 claims. Which 2 claims will you be testing?
So we're planning on testing the ergonomics claim and the thick tissue claim. We've gotten some really good.
Wait. You're not including the big vessel sealing claim? I thought we had talked about this. We need a claim that SuperSeal seals big vessels better than Sealisure. Big vessel sealing is what the surgeons care about. If a big vessel doesn't seal, a patient can bleed out and die. Nobody cares about ergonomics. If a surgeon's hand hurts, nobody's going to die because of it.
Well, the engineers have done a lot of work on big vessel sealing, and we're a bit better than Sealisure. But the results are not statistically significant. The engineers don't think that they'll be able to get statistical significance.
Even if we don't have statistical significance and it's still a little better, we can still make the big vessel sealing claim and use it.
I don't know. Regulatory affairs won't approve the claim.
There's a process by which the VP of Marketing can overrule regulatory affairs and approve the claim. And I'm quite confident that the VP will approve it. He knows how important the claim is, and particularly given the last quarter we've had, we need it.
I don't know. I don't think I would feel comfortable using the big vessel sealing claim if we don't have the statistical significance. I mean, we were the ones who created the test. Remember the American Society of Mechanical Engineers Journal of Medical Devices? Shouldn't we adhere to the industry standards, especially since we helped create it?
There are different ways that we could word the claim so it would pass muster. Plus, it's not like we're putting anybody at risk here. We're just helping to show surgeons that our product is better. It is better, right?
Well, of course our product is better. It's a really great product. I think that surgeons will prefer it because of the ergonomics. And
if our product is better for patients, we should make sure that surgeons know it. And I'll let you make the call on which claims you test. You know my position on it. I must say though, I'm really surprised by how risk averse you're being. To be successful in marketing, sometimes you need to take some risks, and marketers who are risk averse just sometimes don't make it very far. I'm looking forward to seeing your market research plan.